Welcome to everyone. Good afternoon. We'll give a couple of seconds for folks to migrate into the webinar. So happy to have everyone back again for our latest edition of the Gender Equity Education Series. We're so lucky today to have Dr. Rebecca Blanchard join us to lead a discussion on professional coaching and how that can enhance all of our professional development. Coaching, and I'm sure Dr. Blanchard will say this is not just for a single gender. This is not just for women in academic medicine. Coaching is a tool for folks of all genders. So I'm really excited to have Dr. Blanchard with us today. I want to give a couple of announcements. We have a listserv, as many of you know. If you're not on our listserv, please sign up. It is a great way to get communication about gender equity events at the College of Medicine. So there's a link that Emily will put in the chat for the listserv. There's also live captioning that's available, and there's a link in the chat as well for that. And then two other upcoming opportunities. One is our Women in Medicine and Science Peer Leadership Group is starting its third cohort. We're actually starting next week, but we want to give you the opportunity to sign up to be a part of this group. It's for women and gender diverse faculty members. And it's a 6-month program where we meet once a month and talk about professional development and do skill building as well as networking. So please sign up for that as this faculty anywhere in the UVM Health Network. And then the last thing is our Gender Equity Awards, which we give out each year at our celebration of gender equity, which is the first week in March. The call for nominations is going out. We'll be sending out emails, but in the chat, there is a link to a Qualtrics survey if you want to nominate one of your colleagues. There are awards for faculty, staff, and students. Then there are awards for, again, all genders. This is not just for women or gender diverse folks. So with that, I want to recognize Dean Page, who makes a tremendous effort to join us for each of these sessions and learn alongside us. And I'm just going to give him a moment to say hello.
Thank you very much, Dr. Doherty. I think, first of all, I just want to say Happy New Year to everyone. And in advance of this today's talk, we were just chatting, and these the educational series really has been going on. This is the 5th year. When we first got started, and I first got to attend these events, I didn't know what COVID was, and I didn't know what allyship was. And we've learned a lot over the last 5 years. My role is just to say hello and thanks to the committee and all those who support the Gender Equity Education Series, and Dr. Doherty in her role as Director for Gender Equity in the Office of Diversity, Equity, and Inclusion. This series, I think, should make us all proud. We'll celebrate the 5-year anniversary later this year, but this indeed is the 5th year that these events have been taking place, and we've had the opportunity to learn from experts from within and outside of our institution. So with that, I will be quiet and sit back and enjoy an hour to listen and learn with all of you. I do appreciate everybody who has tuned in today and has taken the opportunity to learn along with us. So back to you, Dr. Doherty.
Thanks so much, Dean Page, and 5 years with your support. We really appreciate that. And thank you for making the effort always to come and be a part of these sessions. So I am going to turn it over now to Dr. Leanne Holterman, who is going to introduce our speaker for today. Dr. Holterman.
Thank you. Sorry, my camera just messed up for a second. Thank you, Dr. Doherty. I have the pleasure to introduce my colleague and friend, Dr. Rebecca Blanchard, who is the Director of Scholarship and Professional Development with the Zemrowski Institute for Experiential Learning, a partnership between the University of Kansas Health System and the University of Kansas Medical Center. She's also an education professor at the University of Kansas School of Medicine. As a nationally recognized champion for developing health professions educators as scholars, Dr. Blanchard publishes and speaks nationally on topics in educational scholarship and faculty development. She taught for the National AAMC Medical Education Research Certificate Program and served on national GEA grant committees. She is currently chair for the AAMC Northeast Group on Educational Affairs, and she's also an associate certified coach through the International Coaching Federation and provides academic and leadership coaching for women in the health professions, which brings us here today. A quick note, to ask a question, you will be able to use the Q&A feature. There will be time for questions at the end, but if there's a point of clarification or a particularly timely question, feel free to ask in real time. We'll be monitoring the Q&A throughout. And with that, I would like to turn it over to Dr. Blanchard.
Thanks so much. Thanks so much, Leanne. And thank you very much to all of you at UVM for the invitation to be part of this really important lecture series and conversation. I am so thrilled to be invited, and I'm so thrilled to be invited to talk about something that has changed my life in many ways. And even to offer you all a window into that feels to me like such a gift. So thank you very much. So I don't have any disclosures today, although I am feeling sick, so I apologize if you hear a lot of that today. But I do have some appreciation, and that is I have talked about coaching in different ways before, and I have a dear colleague, Dr. Maddie Hattinger, who she and I have developed some content, and so you'll see some of her, some content that we developed together in some of this talk, and I ascribe it to her, but I just want to shout out her expertise and her partnership. And, you know, I also would like to ask for some agreements. Coaching is a really profoundly personal thing. And you'll see a coaching example today. And I do ask that we create this safe space here where we can take all of the learning from coaching and what it means, and then leave all of the details that you hear. And of course, use the Q&A, ask questions liberally. I would love to make sure you get all of your questions answered. But that's just the agreement that I would love to see from all of us. It wouldn't be a coaching session if we didn't start out with some coaching. So let's do this. I would like everyone to take, I don't know, between 1 and 2 minutes. And I want you to write down the answer to this question for you. The question is, what is the biggest change you'd make in your work or life, assuming you had enough support to do it? Now, you are not allowed to just think the answer. You can type it, you can text it, you're on mute, you can audio record yourself, you can write it, but it has to come out of your brain. There's no right or wrong answer. I am not collecting these. So go ahead. Maybe just take another few seconds. So a question like this is so profound because it's just not how we really talk to each other all the time. We don't generally get into this on a daily basis. And certainly we don't get into these conversations with people who don't have a stake in our answer to this. And it's a profoundly interesting relationship between a coach and a coachee. And we're going to talk about that today. So the agenda for today, obviously we have to start with what is it? What are we even talking about? How does it work? Does it really work? What does it look like? And then what are some things that you can do at the end of this session right away to start putting these tools into your life? So let's start with what it is. I feel like we need to address the elephant in the room. And I love Sarah Silverman, but she tweeted a couple years ago, not all life coaches are crazy, but crazy people are life coaches. And, there's this reputation, right? That's sort of like, who are you to coach me on my life? Like you're a mess and you, whatever. But the reality is that, coaching, it has a reputation, but I had no idea what coaching was until I entered into the training of coaching. I first started taking a fundamentals of coaching class because I wanted to be a better leader. I was a senior director of education at a hospital. I had a department of 30 people. I felt like I needed more there's got to be a different way to lead. And I found coaching to help me as a leader. And I came for those skills and I stayed because of how powerful it was in every other domain of my life. And so, why does it get this reputation? I don't know, probably lots of reasons, right? But it's not a licensed practice. It does have a credential if you want to go through the International Coaching Federation, which requires at minimum 60 hours of education, 125 hours of coaching practice, expert coaching training, and an exam. And then there's all kinds of stuff beyond that, but it's not licensed professional in some other ways. So then what is it? What are we talking about? Well, there are actually quite a few definitions in the literature. So Atul Gawande put out an article that may be familiar to many of you. It is, he did this piece where he talked about having a coach for his surgical skills. And he wrote, coaches are not teachers, but they teach. They're not your boss, but they can be bossy. They don't even have to be good at the sport. Mainly they observe, they judge, and they guide. Okay, it also sounds like a parent, if I'm being honest. But that's one definition. Tara Moore, whose books I'll recommend in a bit, she's a coach from the business sector, wrote a book, and her definition of coaching is a way to work with people's inner lives, but with a focus on action and impact. That sounds great. A little obtuse, but that sounds okay. Nicole DeOrio at the American Medical Association, they've started a group around academic coaching in medical education. They define it as coaching offers the opportunity to improve self-monitoring by fostering habits that will identify deficits and create goals. Okay, and then there's the even more prescriptive, you are a coach if you do these 4 things definition by Lavelle in 2017, which that can be a little overwhelming. So the reality is that coaching I feel like people approximate the definition of coaching, but we never really know, like, what is it? What are you talking about? Well, the definition that I like actually comes out of the organizational behavior literature. And it says coaching is a collaborative relationship. That's what it is. It's a collaborative relationship between a coach and a coachee. And it's focused around the purpose of attaining professional and personal development outcomes that are valued by the coachee. And there's some unique aspects to this idea that it's a relationship. At its core, what is it? It's a relationship. It is not one conversation. It is not, a diagnosis. It is not therapeutic in those ways. It is a relationship, and it's around outcomes that are relevant to the coachee, not to the coach. So coaching is a structured relationship, and there are some pretty consistent elements of a coaching arc. So arc being sort of there's an arc in a relationship between a coach and coachee, the series of conversations. There's also an arc within each conversation. And both of those have some of these components. It really has this sort of visioning and desired state. Where do you want to be? Where are you going? What change would you make if you had the support to do it? And then it goes into concrete goal setting. What does that mean? What does that look like? There's this identifying strengths and self-efficacy. Well, what tools do you have already? What unique skills and strengths do you have access to? And sort of these concrete action plans. It's really about, well, what steps are available to you? What can you do? Well, how have you done something like that before? What's available? And then collecting feedback, checking in. How did it go? What do we need to change? And what's interesting is that the coach doesn't have a stake in what these goals are, meaning, it really is without judgment. If that's your direction, great, let's get there. You want that goal? Great, let's get there. Okay. Moving on. So different helping activities. So let's see. I think most of us are pretty comfortable with this idea of therapy and mentorship. I'm going to sort of start from there and then discuss how coaching fits into those kinds of helping activities. Therapy, I mean, who doesn't love a good therapist? I mean, who doesn't? Therapy is a longer term relationship. It's really more of a psychological discussion, and it's sort of focused on the rear view. The therapist is the authority, and the therapist and patient are sort of focused on what happened. What was that like? How did that get you? And it is more around, sort of this mental health kind of space. Mentoring, and I'm talking when I say mentoring around a traditional, dyad relationship. There's the mentor and the mentee. And it is really future oriented, and it's more longer term and it's unstructured. This really is more of a philosophical discussion. Where do you want to go? Where do you see yourself? What are you doing here with your life? And the mentor is the expert. The mentor has been there. They know which direction to go. Maybe they sponsor you. Maybe they help you figure out how to get where you're going. They do have an interest. If I were you, I recommend going that way. If you want that in your life, then you should do this way. And the mentor really directs the development in that way. And coaching is unique and different from each of these, which all of these have a very important role in your personal and professional development, if I haven't made that clear. They all have a time and a place. They're all critical. But coaching fills in the slot that isn't quite there yet. Coaching is really focused on the here and now, the present. Where are you right now? And where do you want to be? We're not as concerned with how you got here, but we're really sort of saying, well, how can you thrive? How can you do even more? What is it that you want? So there's actually quite a structure to the conversation. There's a structure to the arc of that relationship that we've talked about. And it is really focused on empowering towards action. The coach is really in the passenger seat. It's almost this idea of, the coach holds the flashlight and looks around and says, hey, what about that over there? What's going on over there? And sort of makes it a little bit more clear what's in your view. And the coachee is actually the one directing development and giving judgment and making decisions about the priority of different opportunities. So when might you work with a coach? I have been coached and I have coached others, and it really can be lots of different ways. But remember, I said it tends to be shorter term. On average, I'll work with clients around 4 months. I have found that it's in moments of transition, and I use that not always literally. It could be that, something has happened in your life, something becomes clear, and you just sort of say, oh, I feel stuck, or I don't know what I'm doing. And you can see how therapy and mentoring may not help with that type of being stuck. There's a different type of conversation that can be helpful there. So obviously life and job transitions, if you take on a new role or if you get promoted, or if you're looking for a bigger role, if you have bigger or different goals than those you've had in the past, like, oh, I really kind of want to switch to over there. I just don't know if I can do it. That might be an opportunity to work with a coach. If you have your own sort of personal, big, hairy, audacious goal, that might be a great time and opportunity to work with a coach. We talked about seeking clarity. That's really wonderful. And every human on this planet has inner critics. These are the voices that tell you you're not enough. You're not good enough. You're not smart enough. You didn't say that well enough. You're not fast enough. You're not leading as efficiently as possible. You are not going quickly enough on your academic ladder. You are not taking on enough, whatever it is. You're not a good enough parent, spouse, partner, friend, sibling, whatever. We all have those. And coaching is really, really helpful for managing those inner critics, because those critics that's its whole other talk, but those critics are really voices that have protected you for so long. And particularly with women, these voices come from lots of different directions. And, we tend to have critics that help us please others. And that can really get us into some areas of being stuck if we don't sort of disconnect that from the champion voice that we want to sort of hear about what we can do and what's possible for us. So these are all different ways when you might work with a coach, which I find interesting. What I find interesting is until I actually worked with a coach, I had no idea, like, what do you even want to, what is there to talk about? I'm doing just fine. And then I worked with a coach and I was like, oh, there's so much more. So it's really quite exciting. So how does it work? It's really underlying these theories of change and habit formation. So you can think of coaching has actually been studied in a lot of different types of domains and areas. This is what I'm showing you here is intentional change theory, which comes from the organizational science literature and psychology literature, which sort of starts with identifying the ideal state. Remember, I said visioning, so it sort of aligns the true state. Where are you now? Recognizing your unique qualities and skills, learning opportunities, experimenting with new behaviors. Let me try that. Let's see how it goes. Let me dip my toe in the water, see how that's going. And then, of course, this reflection on that process. And as you can see depicted in intentional change theory on this slide, it is very circular. And these are big circles, and sometimes these are really small circles, depending on the type of action that you want. And if it's not clear already, coaching is really oriented towards action. As Tara Moore said, this is really a process that's not just based on feeling better. It is really about transformation, and a part of transformation is action and behavior. And so I think intentional change theory is probably a pretty good encompassing theory to think about what's going on. And there's a lot behind the scenes here that I don't understand associated with neuroscience that somebody who has that expertise can explain to us. I certainly don't. But I like to think of coaching as this sort of metaphorical splashing water on your face. It resets, it opens you to new possibilities. And then all of a sudden, you have this guidance and support to sort of go anew in a certain direction. So there has been quite a bit of research on coaching. It is when I actually started with KU in May, I was given a coach for a couple of sessions. Our leadership team works with a coach. And the rationale for that is really thinking about how we work together to be leaders and how we think about both our own sense of leadership and identity and, excuse me, how as a team we come together for that. So the outcomes that my director was looking for clearly are some aligning of our vision, some ways of seeing together. Individually, clearly self-awareness. I mean, you can't get out of one session of coaching without coming away with some self-awareness. Action plan. A lot of folks came to report that they come out of coaching with an action plan, which makes sense because at the end of every coaching session, there is an action plan. More confidence, visioning, this idea of sort of seeing things differently, new strategies and tools, and then, of course, just this sort of feeling of reflection and motivation and enacting change. But there's a lot of different types of outcomes that have been reported in the literature, from resilience to skills acquisition and well-being. Clearly, all of this stuff contributes to reduced stress and anxiety. So what does it look like? If that's what it is and that's what it does, what does it even look like? And am I, how do I know if I'm being coached? Well, the reality is that there are all different types of coaching. You'll hear UVM has a wonderful program around health and wellness coaching for students. There are leadership coaching. There's clearly life coaches. There are coaches that focus strictly on academic progress for students. There are coaches that focus on relationships. So you can be a coach that focuses in one area or aspect. And that's often, driven by the coach themselves. But there's all different types of coaching and ways of seeing things. As I mentioned, I work specifically with women in the health professions. They don't have to be clinicians. I've worked with women outside of the health professions, but I tend to work strictly with women in the health professions because, there's a shorthand there. I know what it feels like. I know what I know what it means when you say you're on the unit, or I know what it means when you say you had a leadership meeting and you look around and no one looks like you, or, whatever. So there are all different types, but consistent with all different types of coaching, there are some key coaching skills that we're going to land on for a minute, just to help you think about, what it could mean to be more coach-like in your life. So there are 3 areas. Now, I took, 100 hours of coursework for my certification, but I'm going to teach you 3 skills in like the next 5 minutes. It's totally the same. It'll be fine. So we're going to start with listening. So there are 3 types of listening, and we're going to practice those together right now. So level 1 listening is the listening that we all do when we listen and pay attention to our own minds. So take a few beats and just listen to your internal dialogue. Maybe that voice is saying something about me. Maybe that voice is saying something about you. This is the voice that comes on and says, oh my gosh, talk faster. Oh my gosh, talk slower. Oh my gosh, what are you going to say next? What question are you going to ask next? Oh my gosh, don't do that. You're looking, this way. That's the voice that's constantly going off in our brains, right? And it's tough. If we're listening to that voice, then that attention is being taken away from the people around us. So in coaching, we try to minimize level 1 listening. So if we're minimizing level 1 listening, what are we doing more of? And that is level 2. So level 2 is when you take all of your focus and energy and attention and you put it onto the person you're listening to. So I want all of you to try to focus all of your attention and energy and just listen to me. It's going to be a very intense experience for me, but try to pick up all of the cues. We listen not just to what I'm saying. I talk with my hands all of the time. So, what am I saying with my hands? What are my sort of habits? Do I scratch someplace when I'm not sure? Do I look off in a direction? So just take in level 2 listening. And I wonder if when you're doing that, you're picking up on things that you didn't notice before about me. That makes me feel a certain way, but it's totally fine. I walk myself right into these situations. So that's level 2. Level 2 is really focusing all that effort and attention and energy and focus on the person who's talking or who you're speaking with. Level 3 listening is that energy in the room. It's like when you walk into a space and you're like, whoa, what happened in here? Oh, it's pretty cold in this room, or whoa, there's a lot of energy in here. So level 3 is sort of that, that bigger energy that you can listen to that's going on. It might be something also in a coaching relationship of like, whoa, I've kind of noticed this is the 3rd time that you've tried something and it didn't work. What's going on there? Is there something more to explore? So level 3 is just sort of paying attention to the bigger picture and getting a sense of taking it in. Now, coaches in an individual relationship are going to spend most of their time in level 2 and then level 3. And when we're in level 1, we try to come back out and come right back into level 2 or 3. So if you as a leader, as a partner, as a good peer or sponsor can be in level 2 and 3, what is that person saying? Not what is it that you want them to be saying, but what are they saying? The second skill is naming. And this seems so basic, but this is really hard. This is one of the harder skills for me to learn as a coach. This is 2 parts. So naming has 2 components. The first is just sort of labeling something. And this is a behavior, something that I observe. Hey, I notice you're never on camera when we zoom in. Hey, I notice, hey, I notice that you're constantly talking about, being an artist. I never see some of your artwork. Hey, I notice this. And then the second part of that is being curious without judgment. What do you notice about that? Or what do you think about that? And there's sort of this labeling of, I see that's going on. What do you think about that? Now, this is a great opportunity for feedback giving, but also as a coach, it really is without judgment. Okay, I'm just curious if you've noticed that. And this is a skill that's a little bit more subtle, but it's also an opportunity. Remember when I said coaches don't really have a stake in the coachee's outcome or where they're taking things? This is just such a really nice opportunity to say, hey, I'm going to shine my flashlight in this direction. I notice this. What do you notice about that? Oh, God, I know. I have to deal with that. I don't want to do that later. We'll come back. Fine. But it's just sort of saying, hey, I notice this is here. I can see it too. So that's one of the skills. But the real, the diamond skill of a coach, in addition to these others, is really powerful questions. Questions that uncover a lot of the truth behind what narratives we tell ourselves and others. And these are questions that we, don't often get asked or asked each other. There are some here that seem normal, but in the context of a coaching conversation become a little bit more powerful than you realize. But I listed some here that you could try out in different ways. And these questions are really designed to be questions that are asked, again, without judgment. And also, you'll notice about them, there's no questions that start with why. Why immediately puts us on the defensive. Why are you here? Why did you schedule this meeting? Whoa, don't worry, it's just going to be short. Why immediately puts us as humans on the defensive. So generally these questions start with what or how. And they're really questions that are intended to sort of dig just a little bit deeper than we normally go in our everyday conversations. And they're really also about pushing the person to believe that they could do more or bigger than they thought they ever could. And so it's really just questions to think about what is possible if we've never been invited to consider that prior. Okay. Y'all feel like we could be coaches now? I feel like we could be coaches. Let's maybe, we have a very kind soul, Leanne, who is a friend and a coach in her own right, who has agreed to be coached today. So you're witnessing this, and we'll just go for a few minutes. And again, feel free to take out what you're noticing here about my role. So you're all focused on me, not so much Leanne, about the coaching, just to get a sense of what it looks like. Okay. Hi, Leanne.
Hey, Rebecca.
How you feeling?
I'm feeling a few things. I'm excited to work with you and to get coached, and also just inspired about coaching in general. As you mentioned, I do some coaching myself, and so I'm taking some interesting points for my own practice in this as well. And so, yeah, and also, feeling the Wednesday vibe.
Is the Wednesday like the hump day vibe, or is it like, woo, it's Wednesday and there was a storm and now nobody has it yet?
It's all the things. It's
All
all the things, yeah.
Okay. Anne, can I ask you please to just chat me when we're at 5 minutes, just so I don't run away?
Okay.
Thank you. Because I could talk to you for hours. Okay, Leanne. So I guess I'll just sort of start with, I don't know if you thought about it. Is there a topic that you'd love some coaching on today?
Yeah, I did think about it, and I would love to talk about, I'm trying to navigate the waters of promotion, the faculty promotion process, and trying to figure out what activities I need to put my attention on in the next couple of months in order to really boost that process for myself.
Okay. And what's your ultimate goal? What do you really want out of the process?
So out of the process, my ultimate goal is to get promoted to associate professor. So that's the next assistant professor now. So that's the goal, is to have a successful application. And honestly, like, it's a little overwhelming. There's a lot of components, and just trying to figure out where the puzzle pieces fit together. It's definitely a journey. And so, yeah, getting to that end point of a successful outcome would be great.
Okay. And what about being promoted is important to you?
A few things. I think personally, it's part of my desire for growth and keeping with my growth mindset, expanding my skills and my expertise. Also, it gives me opportunities to give back to my colleagues and to the institution, and also to my department that supported me, and just that feeling of growth and learning. And also part of it is the recognition of the hard work that I put in, and yeah, so a lot of things.
Yeah. Yeah, that sounds great. I mean, I know you love learning, and I know this space is really important to you. So those sound like they track. So what would be like you said, navigating the waters? That makes me think of like this canoe and sort of treacherous waters. So what is the first sort of boulder that you're encountering that you're not quite sure how to navigate around?
Well, first, I want to acknowledge the support I've had so far, which from some really important people in my life, getting support in terms of understanding this process and um, trying to see, okay, like we know there's these steps to get there, but also how do you uncode that and say, what is that committee looking for? Like when they say this, what does that actually mean? Like what is the code I need to understand to be able to say this matches that? And so I've had support along there. And I think, I mean, it's a little bit nebulous because so many people have different pathways and so many people have different ways to get there that there's that personalization piece that's important to discover. And I think for me, navigating that means, all right, so there's all these components, whether it's leadership or teaching or research, that are all an important part. But like how do I manifest what that looks like for me? How do I draw on what I've already done? Where do I build? Where do I put that energy now to say, okay, I have time for one extra thing that I can boost in this portfolio. What should that be? Like what's the most important thing? Is there something that's really important to me, or is there something that I'm not seeing that would be really important from the perspective of the committee or whoever making the decision?
Yeah, I just want to call out that it feels like there's a lot of stuff here. It feels like you're trying to decode requirements and you're also trying to figure out who you are through this process, and you're also trying to figure out the best pathway. Is there one thing that you want to focus on first?
That's such a good question, and that's I think where my main struggle is because and you might have learned this about me over the years, but my interests are wide ranging. There's so many things that I like to do, and so I end up while I think that's a strength, I also think it's a challenge because it's hard for me, everything sounds interesting, so it's hard for me to say this is the most interesting. And I think that's the core of the battle is like what's important to me, where do I put that weight, like what's important to me versus what's important from this process perspective.
Yeah, okay. So what is important to you
um
in relation to this process?
yeah, I mean, as I said, the important thing is having successful outcomes, so doing what it takes to get there. But since I'm feeling you know, like I've been doing the right things, it also feels like this is a chance for me to find something that's actually, that's also going to continue to either improve my skills or draw my interest or something like that. So being able to let go a little bit and say, where can I put my energy that's also going to be something that's really fulfilling to me and not, checking a box or anything like that.
Yeah, so it's this both, I want this to capture who I am, but I also do need to check the boxes.
Right. Yeah,
All right.
exactly. There's definitely both.
So we're almost at time, but if there were one word that could describe who you want to be through this process, one word or phrase that could describe who Leanne is, or how you want to be when you go through the process of academic promotion, that you want to stay true to, what might that word or phrase be?
That is such a good question. It's hard to pick like one word or phrase. I would say that the couple things that stand out to me are being authentic and having a growth mindset and this sort of idea of reciprocity, like that there's a cycle of support from both the individual and the institution, like that we're all helping each other, I think is sort of that collaboration, I think would probably be a better word, is what I'm going for. So yeah, authenticity, collaboration, and a growth mindset, I think are the things that I'm hoping to have this process represent for me.
Yeah. Well, and that totally rings true with your values. So I'm sure that that's why it rings true for you in this process too. Well, thank you very much. And if we were going to keep coaching, we would dive even deeper into this and make some moves. So thank you for being a willing client today,
Yeah,
Leanne. I appreciate it.
thank
And
you. And that was helpful for clarifying some of my own feelings about it. I really appreciate that.
No problem. Just the two of us in this tiny little intimate chat. No problem. Okay, everybody thank Leanne very much in the Q&A in the chat. That was great. So I just she's so good, isn't she? You know, I think there's a lot of opportunity, and we can deconstruct that talk. 5 minutes is just not a lot of talk, but not a lot of time. But even in 5 minutes, you know, you can keep drilling down to what ultimately is it that you're looking for. So just for all of you, what can you do today with these tools around coaching? And what can you do to think about coaching moving forward? There's a few opportunities. And the first is to talk about coaching. You know, there's this article that Chris Watling and this group wrote a few years ago about the learning culture in music. And they said that the notion that an autonomous professional, meaning all of us, might benefit from a coach causes distinct discomfort within medicine. Much can be learned from music, the learning culture of which not only normalizes the use of coaching throughout a professional career, but expects it. Can you imagine, you know, the culture that we could create or perpetuate? Sorry, excuse me. If we talked about coaching and accepted it and invited it. So I do think it's one opportunity is to really put it into your toolbox with those other helping activities that we're so quick and so accepting of as one more way to support each other and to support our learners. The second opportunity clearly is to work with a coach. You know, obviously I coach a few clients every year, but I also put up here 2 colleagues who are incredible coaches who I've both been coached by. Paula Alankar coaches teens up through adults. She's run leadership workshops for women. She speaks Portuguese fluently and English. And Dr. Maggie Hattinger, who I've mentioned earlier, she and I run coaching retreats together. And so there are opportunities to work with a coach, and also at UVM, there are opportunities as well. Also to take on coach-like strategies. This is a quick book. I don't know if you all have heard of this book. It's a quick and easy read. And it talks about how as a leader, you can take on very specific coaching questions and show up in these settings with a little bit more coach-like environment, a little bit coach-like in the way that you listen, in the way that you ask, in the way that you engage those around you. And he's talking about leadership, but the reality is all of us are in positions of influence in one way or another. And so if we can take these coaching skills into those positions of influence, we can have an opportunity to push the people around us to own their amazing skill sets and their amazing potentials. Obviously, there's coachy reading. I could go on and on. There are a lot of great books out there, and I'll share some references. There are really wonderful books on ways of thinking about, if they're not specifically about coaching, they are about how we show up and how we communicate, how we lead, how we think of ourselves differently. This book, Range, the Green Book, I was working with a coach and I was struggling a lot because at the time, I was really having sort of this identity challenge that I said, gosh, I work at a hospital and everybody around me is a specialist. You ask somebody and they can give you a one-word answer of what they do. I'm a surgeon, I'm a librarian, I'm an internist, whatever it is. I'm a nurse. And all these people, they had one-word answers and you can know immediately who they were and what they did. And I felt like I always struggled to answer the question, what do you do? And I struggled with it. I don't know how to explain what it is that I do. And he said, well, it's because you're a generalist. It really sounds like you're a generalist. And I had never heard this term. I didn't know what he was talking about. And one of the things that came out of that coaching session was, you know, I said, well, obviously I love learning. I have to read about this. I don't even know what it is. And I found this book on generalists, and it completely changed how I thought about my skill set. So, I mean, you know, you would think I have a PhD. Clearly, I feel like I'm an expert in something, but it was sort of this identity lapse that I do these other things. I'm not just one thing. And the idea of having a term for it and having a way to access those skills and move forward completely changed confidence, all that thing, those outcomes on the pie chart, I went through them. And it's amazing how, one conversation can help lots of things click. And I just leave you with this. Jen Sincero is a coach as well, and she wrote this book. In it, she says, trade in your drama about how you can't have what you want for the grateful expectation that miracles will walk into your life. And the more commonplace those miracles will become. And the true underlying of coaching is that we build from our perspective, not our reality. And, this idea that you could shift your perspective and have huge gains is about the lowest risk gamble with the biggest payoff going. And so it's really a huge and powerful opportunity to think about all of your unique strengths and skills and qualities and what's possible for you. Thank you very much for being here. I really appreciate it. I'd love to answer whatever questions that you have. And there's a handout that I think I sent that maybe can be distributed, but thank you.
Thank you, Dr. Blanchard. So great to have this conversation. Coaching is a wonderful tool to have in the toolbox, and appreciate you sharing your experience. So please, folks, use the Q&A to submit questions for Dr. Blanchard. We have a few minutes for questions. And I'll also say there's a really lovely testimonial for Dr. Blanchard that was submitted in the Q&A from Dr. Greenberger, who's one of our faculty members, attesting to how you in particular and coaching in general has helped her to identify her values and her priorities and find the courage to make important career changes that have left her feeling the best version of herself. So thank you for doing that for one of our faculty members. And my bet would be that there's more than one of them out there. But that is a great testament to what you can get through coaching. And one of the things that I love about it also is that it's for folks at all different levels. There are always changes and transitions that we're making in our careers. So from the earliest onboarding of an instructor, an assistant professor, up to the dean level and beyond. So one of our questions is, how do you overcome the skepticism of coaching?
I guess my question would be, what's at risk there? My sense is that there's something that's trying to be protected that you're a little worried about if you work with a coach. The nice thing about coaching is generally, it's like therapists, I think, in the sense of, you have to find the coach that works for you. There are male coaches and female coaches and different ages and backgrounds and cultures, and you have to find somebody who works for you. But the reality is, you have an initial conversation with them. And, if you're somebody who really doesn't want to be called out, like, no, I just tell me where I'm going and what I need to do, that's probably not the right thing to work with a coach. I don't know how one personally addresses their skepticism other than to reflect on what is at risk. And if you're feeling like it's, not worth your time or your money, most coaches will have a conversation with you for no investment. And if they don't, then it's probably not the right coach for you. But they'll talk about what goals are appropriate and, how they can get there. And then if that feels right, then you can move forward.
Thank you for that. Another question, can you share your skills or tips around protecting your own energy as you do this important work?
Yeah, that's such a great question. It's so important to be mindful of your own energy. So, I guess, as a coach, so I assume you're saying protecting your own energy while serving as a coach or a coach-like colleague for others. Generally, it's less effort because you are not taking the monkey onto your back. The good thing about coaching is the initial fundamental belief is that we believe everybody is competent, creative, resourceful, and whole, meaning everybody is able to solve their own problems, right? We're not working from a deficit mindset. It's not therapy. We're not sort of, helping to mine and to treat. We're starting with people who are competent and whole. So if you hold this belief, you don't have to solve or fix anybody or any problems. They're capable and competent to do it for themselves. Your goal is to hold the flashlight or turn a light on, or be curious. And that actually takes the most energy that takes is to like put aside everything else for 10, 15 minutes. And I've had really powerful coaching conversations in 15 minutes, especially if you train the people that you work with to say, come up, what is it that you want? What is it you really want? What are you looking for when you walk away from this conversation? Do you need reassurance? Do you need guidance? Do you need clarity? What do you need? And then, if it sort of, we don't beat around the bush, because remember, a coach doesn't have a connection to the outcome. So it's really, what is it that you're looking for and what is it that you need? So yeah, I hope that makes sense.
I would imagine that you encounter some emotionally charged situations where even assuming that that person has the capability to solve the issue and that they're whole and they're competent, that you still feel that. I mean, that's part of taking care of patients, right? And so I'm just wondering about, I think there is something in there about protecting yourself or not internalizing that. But I do love that starting point, because I think that starting point is so important. You are confident, you are whole, you have the capability to work your way through this.
Yeah, it's such a good point. And I mean, I also work with coaches, right? And I work with people who I say, I just need help with this. But it is for sure managing the energy. Yeah.
Another question. Well, there's one question about a link to the references. Did you have a QR code? I didn't see a QR code, but I may have missed it on the last screen. And if you can put something, oh, there you go. That's great. So if folks want to grab the references, you can get it through that QR code. And then there is another question about, can a third party match coach and coachee based on specific skill, or does that undermine the relationship?
Yeah, I mean, it does not undermine the relationship. I think, it's really helpful to find a coach that focuses in the areas that matter to you. And like I said, there are coaches that focus in all different kinds of areas. And so, I try to map people with coaches all the time if I don't have room or can't take anybody on, or if I know they're looking for something that a colleague of mine is much better at, I match people up, or at least refer them all the time. And I think that goes a long way. I mean, the relationship is what matters most. So how you find it and how you get there and what goes into a trusting relationship can really be up to you. And you're allowed to decide what that should be based around. I want somebody who understands what it's like, to be in this type of environment. I don't, want to work with a male. I don't want to work with a female. I don't want to work with white person, whatever. I think there's, an opportunity to say, it's okay, whatever matters for you, because I think, that's how this stuff is really powerful. This stuff is really asking you to get pretty honest with yourself, and you want someone that you trust to hold that quite well. And I think you're allowed to set the parameters for that.
Perfect. If anyone else has questions, we probably have time for maybe one more question, maybe two. I did have a question about how you end the coaching relationships, right? You said this is sort of time bound. How do you actually create that? Okay, you're done. We did the thing. Go and be free.
Yeah, I'm breaking up with you now. No, I actually don't set it. So it tends to run its course quite naturally. You know, if you come to me and say, my goal is to have a bigger or better job, or I'm not happy in the job that I'm in. We work through, and ultimately you've applied for another job, or you feel clear about the kind of role you want and you start applying to those, and you feel like now you're on track, then we've achieved the goal that you set out to achieve. It's quite natural. It doesn't feel jarring at all. It feels very obvious that, oh, okay, now, yes, I have done those things. I am on track. I am going in the direction I wanted to be going. And that's why I say it, I run a program that's very, it's session by session. So it's not a 3-month or 2-month or whatever program. So it's ad hoc and can be every week, once a month, every other week, whatever. But it follows a natural course trajectory, I would say.
Great. Well, I think we're wrapping up here. I want to thank you so much, Dr. Blanchard, for being part of this education series. We really appreciate your time and effort and the skills that that you have that you're bringing to the coachees that you're working with. If folks have questions for Dr. Blanchard, we just had her email up, and if you didn't get it, you can reach out to me and I can give it to you as well. I also wanted to let folks know that the Women in Medicine and Science Peer Leadership Group is open for registration for women and gender diverse faculty members across the network. Watch out for calls for the nominations for the Gender Equity Awards. This is a great way to recognize your colleagues for the important work they're doing to support gender equity. And our next session will be February 7th. Again, it will be at the noon hour via Zoom, as always. Dr. Christy Foreman, who is a child psychiatrist out at University of Colorado in Denver, will be with us, or Boulder. Anyway, University of Colorado. She will be with us. She actually trained did some of her training with us here at UVM, so it'll be great to welcome her back. And she is going to be talking about positive psychology and lifestyle medicine. I met Dr. Foreman at a conference recently and was really interested in, again, we're talking about not coming from a deficit mindset, coming from a place of positive intent. And that's what she's going to be talking with us about. Also, I had put in the chat a connection to the UVM Osher Center, which has an opportunity for employee coaching. So please do check that out as well. And we'll see you here next time. Thank you so much for taking your time to be with us today, and be well.
Thank you.